Good morning and good afternoon to everyone. Thank you so much for joining us today for this protection dialogue. This year's High Commissioner's Dialogue on Protection Challenges is considering the implications of the COVID-19 pandemic for the protection and resilience of refugees, internally displaced, and stateless people, as well as their host communities. Throughout the dialogue, participants and speakers will have had a chance, both in the past and in the future, to reflect on how to address pressing protection and solutions questions related to the pandemic, building upon the International Refugee Protection Framework and principles, as well as the arrangements set out in the Global Compact on Refugees. This is the second in a series of 4 virtual sessions. I'm Shahrzad Tajbakhsh. I'm the Deputy Director in the Division of International Protection, and I'm very happy to welcome you today. This session will be followed by a virtual session on resilience and inclusion in healthcare systems and one on lessons learned on climate action. A final session is going to be held in December, and further details about the format of that session will be provided soon. A few words just on housekeeping, if I may. Interpretation is available in Arabic, English, Nepali, French, Russian, and Spanish. Please select your preferred language using the interpretation button at the bottom of the screen. If you would like to hear only the interpretation, please select Mute Original Audio. If you encounter any issues with the platform, we are providing a video backup live stream in English and French, as well as an audio-only live stream in English at the URLs shown on your screen and as shared in your connection instructions email. There are also English closed captions for increased accessibility, with many thanks to our colleagues. To enable, click on the CC button and then choose Show Subtitle. You can submit questions and comments throughout this session, and we welcome you to do that, please. In the Zoom platform, use the Q&A button at the bottom. Note, please, that you do have the option to anonymize your question if you wish. If you are following the live stream or in the event app, please type in your question or comment in the session chat. With these words, I'm very happy to hand you over to our moderator for this session. Bart, over to you.
All right, thank you so much, Shadia, for giving me the word. I'm really happy to be a moderator today. I hope you are getting me loud and clear. Welcome to the protection session of the 20 Virtual High Commissioners Dialogue. My name is Barthélemy Mwanzangane. I am a member of the Global Youth Advisory Council. I'm really happy to be your moderator at today's session. I understand that COVID-19 cannot stop us from meeting. Internet connectivity, a key milestone of online communication, has allowed us to be together here. For this protection session, we are really pleased to have with us a distinguished set of panelists and, importantly, representation from a wide spectrum of stakeholders. Let me welcome from the Ministry of Foreign Affairs of Ecuador, Ms. Maria Fernanda Ceballos, and from the civil society representative from the Refugee Consortium of Kenya, I'm really pleased to welcome Ms. Lila Muritia Simiyu. Very happy to have you. And we are going now to receive from the Good Deeds Foundation and a member of the internally displaced community in Ukraine. Really pleased to welcome Ms. Tamara Maximovna in Zutova. And from the Zaatari refugee camp in Jordan, we are really pleased to welcome to the community volunteer, Ms. Ala Ali Al-Qasim. And from the Japa refugee settlement in Nepal, very pleased to welcome advocates for women and persons with disabilities, Ms. Devi Maya Gurung. Before I turn to our panelists, I would like to invite the Assistant High Commissioner for Protection, Ms. Gillian Triggs, who I invite now to make a few remarks to frame our discussion on the protection challenges and responses to COVID-19 for and by forcibly displaced and stateless communities. Ms. Triggs, I hope I find you all, and please, over to you.
Hello, everybody. I do hope that you can hear me. I'm absolutely delighted to join this second session of the High Commissioner's Dialogue, and we hope very much to be able to build on the momentum of the first session where we heard from refugees themselves, and Bath was one of those, in conversation with the High Commissioner and with the Deputy High Commissioner, Kelly. Of course, COVID has brought us much tragedy, much grief to so many people around the world, but it has brought us to some level of creativity, because here we are with the first of the High Commissioner's Dialogues ever to be run virtually. And I understand that we have something in the order of 700 people, 700 participants, and we've been able through this technology to reach places and people that we would otherwise never be able to reach. So I'm very much looking forward to this, looking forward to using the technology. We're going to hear, as Bath has said, from Ecuador, a country that's shown great compassion in using technologies to ensure asylum claims are considered. Hearing from a refugee consortium in Kenya, from a Ukrainian displaced in her own country, from a community volunteer in a Jordanian refugee camp, and from the Bhutanese Refugee Consortium for the Disabled. Well, our guests are going to provide an on-the-ground perspective of how COVID-19 has exacerbated the protection needs of refugees and those who are displaced or stateless. Their experience will emphasize one of the vital lessons that we've learned here at UNHCR from the health emergency: the effectiveness of working with local communities as first responders. They're integrated in the communities and they know firsthand what is most needed for protection. UNHCR is committed to investment in local communities and to ensure protection of all those forcibly displaced, to ensure that they are genuinely able to participate in decisions that affect their lives, but also to ensure that UNHCR itself is accountable to those we serve through the lenses of age, gender, and diversity. Well, in my brief remarks, I'd like to stress, if I may, the protection challenges posed by COVID-19 to fundamental refugee laws, the right to seek and enjoy asylum from persecution and violence, and the absolute prohibition on returns of an asylum seeker or refugee to a place of danger. Over the decades, these asylum principles have been respected by almost all nations and are now well recognized as binding customary law. And this year, UNHCR celebrates its 70th anniversary, and we've reported nearly 80 million refugees and others forcibly displaced, a number that's unprecedented and one that does not include unknown millions of those who are stateless. Not only have the core legal principles been severely strained by the rising numbers of those in need of protection, but also they've been tested unexpectedly by the COVID-19 pandemic. In response to the health crisis, some governments have adopted world's best practice and humanitarian practices generally. Other governments have adopted blanket denials of access to territory to seek asylum, or they've forced returns or pushbacks of refugee boats to further danger and persecution. Indeed, at the height of the pandemic, 160 countries fully or partially closed their borders, with about 80 states making no exception whatever for those people seeking asylum, seriously limiting access to protection and creating very significant backlogs for asylum claims that I think we'll be dealing with for many years to come. 27 countries returned asylum seekers to their country of origin, risking breach of the prohibition on refoulement. and states have denied disembarkation to refugees rescued at sea, leaving many to die of dehydration and exposure. There's a growing use by some countries under the guise of quarantine restrictions to impose immigration detention for asylum seeker families and their children for disproportionate periods that have become arbitrary. There are, however, some best practices that we can learn. Today, over 100 countries have shown how to continue their asylum systems by adopting flexible and creative remote digital technologies to register asylum claims, to conduct interviews or submit documents or extend visas. While millions of forcibly displaced children have missed school, some NGOs and community groups working with governments and other stakeholders have ensured access to education through remote programs. And one of the advantages already emerging is that those who've had the advantage of these programs can return more confidently to schools once they're reopened. Some countries, such as Uganda, have opened their borders to allow thousands of people to seek asylum from violence in the region. And others have hosted refugees for many years, including, of course, Turkey, that has hosted 4 million refugees, mostly from Syria, in a conflict that's now in its 10th year. And Bangladesh generously hosts 860,000 Rohingya, including over 700,000 who arrived 3 years ago. Well, UNHCR has been clear. It is possible for a country both to protect the public health of its people and to ensure access to territory. One does not exclude the other. Measures restricting access to asylum must not be allowed to become entrenched under the guise of public health. Efforts by some countries to avoid protection obligations by passing them to typically poor and third countries should be resisted, and policies of returns of asylum seekers to their country of origin in violation of the principle of non-refoulement must be rejected. Well, I've stressed the fundamental rights under refugee law, but the pandemic has also threatened social and economic rights of the most vulnerable, and among them are refugees and those forcibly displaced, who all too often depend upon the informal economy. They are among the first to suffer the economic impacts of a lockdown. They've lost their jobs or been evicted from homes. Lockdowns have increased family tensions, leading to spikes in gender-based violence. Children have been out of school for many months, and Save the Children estimates that about 4 million refugee or displaced children may never return to school post-COVID. The economic impact of the virus has also increased the incidence of child marriage, of abuse of children in various ways, including, of course, adolescent pregnancy among girls. The numbers are rising worryingly. UNHCR offices report increasing instances of discrimination, stigmatization of those who've contracted the disease, and xenophobia against refugees and displaced peoples, exacerbating tensions among local communities. The desperation among those forcibly displaced has prompted unpredictable pendular movements of people leaving and returning to their country of origin or to a host state. And the stress and despair of vulnerable people in the pandemic has led to rising mental illness, a legacy that communities will need to address for many years to come. To respond effectively to all of these impacts of the pandemic, UNHCR wants to learn lessons for the future, to prepare better for the future, but we're advocating in particular for the inclusion of vulnerable people in social safety nets in countries where they've found safety and sanctuary. In protracted conflicts in Afghanistan, Syria, Myanmar, parts of Africa and Central America, voluntary repatriation is unsafe. Durable solutions such as resettlement is available to very few in practice, though I do take this opportunity to hail the generosity of Canada in expanding its resettlement program this year, and we urge other governments to do the same. But a realistic and a practical opportunity for protection lies in social inclusion in the host nation and non-discriminatory access to education, health and employment. The virus is blind. It doesn't distinguish between legal status and nationality. Access to health services should not depend on citizenship or birth registration or restrictive visa conditions. We now understand better how important it is to include all those forcibly displaced in social services and safety nets. Well, 2020 has been a year where international standards of refugee protection have been severely tested. For our work at UNHCR, the Global Compact on Refugees provides the vision and the practical mechanisms to ensure that the health pandemic does not become a protection crisis. With the tragic death of 102 million people and 45 million cases, the pandemic has shown us the enduring importance of sharing responsibilities. We know that the pandemic can affect all of us. We can no longer exclude people on the basis of their legal status. The future must be one of inclusion. So I very much look forward to hearing the experiences of our guest panelists, and I now return to our moderator, Bath.
Yeah, I'm sorry I was unmute. Now I'm back. Thank you so much, Ms. Trix, for your remarks. And this allows me to turn directly to our first panelist, Ms. Maria Fernanda Ceballos from Ecuador, who serves in the Ministry of Foreign Affairs as the Director of International Protection, who will speak on the access of national asylum system and the issue of documentation. Ms. Ceballos, here is your question. Like every other country, Ecuador was faced with difficult dilemma, such as how to strike the balance between legitimate public health concerns and the imperative to continue identifying persons with international protection needs. What are some of the key lessons learned, positive and not positive, from the response to COVID-19 crisis in Ecuador with regard to refugee reception, the national asylum system, and personal documentation of all kinds? And moving forward, what needs to be done in terms of adjustment to ensure continued protection and documentation services? Ms. Maria Fernanda Ceballos, over to you.
Buenos días desde el Ecuador, el país de la mitad del mundo. Para mí es un enorme privilegio participar en este importante.
Good morning. For me, it's a real privilege to take part in this forum, and I'd like to take advantage of this opportunity on my own behalf and on behalf of the government to thank you for the invitation. This allows me to share the experience on good practices that we've established to assist the population in need of international protection.
Ecuador is
the country in Latin America that has recognized the highest number of people as refugees. Historically, we have more than 70,000 people with this status. During the COVID-19 pandemic, we were able to look at opportunities to strengthen ourselves by guaranteeing continuity in the process. The decisions to maintain isolation and working from home due to the COVID-19 pandemic allowed the Ecuadorian state to see this situation as an opportunity to strengthen our systems by innovating and overcoming the barriers associated with technology. Something that's very important, and I hope this doesn't come across as advertising, but in Ecuador, we were already prepared for this moment with the Progress V4 system. The results we have achieved is more than 2,000 records, 4,000 visas have been renewed, and 5,500 consultations. And we've been able to assist more than 16,000 people remotely and continue to help people by continuing to work from home. In Ecuador, from January 2018, I took the decision to deliver the contingency plan of the Commission on Refugees and Statelessness. The main objective was to respond to the existing backlog of applications. 9,238 had not been processed, some since 2006. The plan involved establishing a strict schedule of work, organizing the administrative aspect of the Commission to make it sustainable, organize remote working so that the members of the Commission could concentrate on individually analyzing each case and taking decisions.
Gornoparni. Yeah, I'm not mute. I'm speaking.
La emergencia sanitaria nos
The health emergency forced us to look at the experience of the Commission, and we were able to continue to apply the procedure. We had already practiced working from home for 2 years, and we successfully completed the contingency plan, reaching or making slightly over 26,000 decisions, which is a milestone for the region.
El trabajo de la Comisión de Refugio y
The
Apatría
work of the Commission on Refugees and Statelessness has not ended since we continue to receive applications. We are still applying the contingency plan for admissibility or eligibility, and that has allowed us to process over 40,000 applications for international protection.
Nuestra meta es ser más eficiente
Our goal is to be more efficient
y que
I'm
los
busy. I
peticionarios
just
sean
phone at
atendidos en
and that applicants are dealt with in the shortest time possible. And we're doing this because cases are going through the admissibility and eligibility interviews and then are immediately included in the Commission's agenda on refugees and statelessness, regardless of whether these interviews are conducted on site or virtually through our innovative system. The priority will continue to be working together, which is why we've established the necessary coordination mechanisms with institutions such as the Public Defender's Office and the Ombudsman Office to handle interviews for unaccompanied children and adolescents.
También con la sociedad civil organizada, como
Along with civil society organizations like the Diálogo Diverso Foundation, which is a foundation that works with LGBTQI+ people, we were able to coordinate our forms and include sex and gender diversity so that people could identify in accordance with their self-determination. We want to be a safe space for these people. It's also, or the coordination we've had with NGOs has also been very important, like the Norwegian Council and HIAS, who, in addition to making their facilities available to us for conducting interviews in environments that allow us to apply the principle of confidentiality, they support us in these innovative ways of continuing to serve our population of interest. For Ecuador, it's important to emphasize the fundamental contribution of UNHCR in the framework of the strengthening program with the Ecuadorian Ministry of Foreign Affairs through the implementation of Progress V4 system, the financial assistance for the delivery of contingency plans, and the fact that they have accompanied and supported us in our technical decisions. I'd now like to talk a little bit about our future. We will continue to apply contingency plans that have given us positive results and with which we have made significant contributions so that people receive answers. The tools ensure access, but there is a digital gap and a lack of human and material resources that put at risk the capacity and timely management that we're trying to consolidate. We've taken important steps and we must continue. International cooperation is crucial in order to improve and expand the state's response. A clear example is that in Ecuador, we invest in health and education for all people who are in Ecuadorian territory. This, of course, includes our population of interest, and to achieve this, we must have cooperation. Despite this very difficult tax situation we have in Ecuador currently, we continue to serve the population of interest with our greatest efforts in order to integrate people in need of international protection at local level. And there is an increasing demand for our services, and of course, the pandemic creates unforeseen circumstances, and only by coordinating can we respond adequately to this. And now I'm at your disposal should you have any questions.
Yeah, all right. Thank you so much, Miss Maria Fernanda Ceballos, for sharing these positive examples, which clearly indicates that the international protection can indeed be extended while also addressing health considerations. We'll come back to you for questions and answers, but for now, thank you so much for sharing these positive examples. Thank you. So let me now turn to our second speaker, who is Miss Leila Muritia Simiyu from the Refugee Consortium of Kenya, to speak on some of the broader protection considerations. Miss Simiyu, shortly after the first case of COVID-19 was announced in Kenya on 12 March 2020, I understand that the country closed its borders with neighboring countries and imposed curfews. Routine services for asylum seekers were suspended, and while the government took measures to ease the economic burden on the populations, surveys indicated that the negative impact of COVID-19 was widely felt by already marginalized refugee and stateless communities. So my question is, can you please tell us some of the key achievements have been to respond to the negative impact on refugee stateless populations, and what would your recommendations be to address the concerns identified during this COVID-19 response in the mid and longer term to ensure that refugee and stateless populations are able to recover from the effects of the pandemic? Ms. Simiyu, over to you.
Thank you very much, Bart, for that. So I'll start off with the key achievements, and I'm going to look at, in terms of overall key achievements for both refugees and stateless persons. And I would wish to say that, for instance, in terms of sharing information on COVID-19, agencies like UNHCR, through partners and even partners themselves, were able to share information with refugees, asylum seekers, and stateless persons. And the information was about hygiene measures, restrictions on movements, and all of this was aimed at reducing the transmission of COVID-19. Testing and treatment was also available for those persons who exhibited symptoms of COVID-19, and even if they didn't exhibit any symptoms of COVID-19, testing was still available. Then also provision of masks, sanitizers for vulnerable refugees, asylum seekers, and stateless persons was also available. And then there are also those refugees who are also able to make masks and soap, which was used by both the host communities and refugees. Now, specifically for stateless persons, we saw a positive role with the county governments in terms of ensuring that there was flexibility during the curfew hours. For instance, the Pemba community, which is a stateless community, are fishermen. And so the curfew hours limited their livelihoods because then they could not fish at night or early morning. So when the county authorities received information about the negative impact of the curfew on the fishermen, they engaged the national government, which allowed for exemptions of the curfew for those persons who had fishing permits. And other local authorities took action, and in a similar manner also granted other members of the stateless community permission to fish during the curfew hours. So they were given a unique identification number from the Marine Department, which reduced arrest and police harassment during the pandemic. Then also for the stateless persons, there was a facilitation of movement for those who did not have documents. Because with the COVID-19 restrictions, there are those persons who are Kenyans, but they're also registered as refugees in Garissa County. So the National Registration Bureau issued letters addressed to the police, which facilitated movements of these people, and especially persons who may become stateless if their Kenyan citizenship is not confirmed. And this allowed them to move around to places of work or business without harassment by authorities. When it comes to refugees, in terms of ensuring refugee protection, generally there was a suspension in terms of extension of the residence permit and other stay permits for all foreigners. And in a way, this also positively impacted the refugee protection space because we did not hear of cases where refugees or asylum seekers were arrested on charges of unlawful presence in the country. And normally this charge has a deportation charge and repatriation. While the borders were officially closed, there were those persons who were able to come in through various porous border points. They were received in the refugee camps. They were tested and placed in quarantine facilities And then when they were confirmed negative, then they were relocated back to their communities. Also during that time, there was ensured continued access to services. There was facilitated relocation to the camps for persons who are unable to sustain themselves in urban areas. So this enabled refugees who are in urban areas to access services and support in the camps, and this eliminated protection risks, which they would have faced because of the negative impact of COVID-19. And then there was also enhanced use of technology, and there was a need to also raise awareness, which was also done with the refugees about the legal system, because during the COVID-19 period, the judicial system had brought in a virtual platform, which was new, totally new. And so it was very important to engage refugees more using technology so that they could also be able to access justice. And also other services were provided using online platforms, for instance, telecounseling. And then there was also inclusion of refugees and stateless persons in terms of the response plans by the government from the beginning of the pandemic. And in particular, when it came to education and health response plans. And there was also improved coordination, which was very essential between different actors, between government, UN agencies, and NGOs, just to ensure that the limited resources that were there at that time to address protection concerns were used efficiently. The other bit was about communication. Innovative methods had to be applied to be able to communicate with both refugees and stateless persons, given the limited physical contact. So for instance, there was development of WhatsApp trees and also ensuring that persons of concern were able to access information online. In terms of recommendations, one of the key things is health, to ensure that there's continued health services, because that is very critical, but also looking at mental health. There were increased cases of attempted suicides among the population. So mental health is something that is really key going forward to really critically look at, but also not forgetting the mental health of humanitarian workers who are either infected or affected by COVID-19 and also suffering from vicarious trauma. So it is also important to look at also their mental health so that they're able to provide the necessary services and support to persons of concern. In terms of education, support would really be required to reopen the schools in terms of ensuring that physical distancing is maintained. There is increase in terms of sanitation facilities, and also support to children who became pregnant during the COVID pandemic as a result of rape or defilement, so that they're able to access school. They don't face any discrimination based on what happened to them, either from their school, their classmates, their families, or communities. The other bit to look at is in terms of livelihoods. It's important to look at recovery of economies, having targeted support of entrepreneurs, and also tying that up with refugees and stateless persons being able to access identity documents and other documents that would enable them to engage freely in livelihood activities. And then also inclusion of refugees and stateless persons in social safety nets, which would contribute to realization of social economic sustainability. And also with leaving no one behind, there's also need to further support the government and society in order to ensure that everyone is included. And all this would require an encompassing legal framework so that there is support for county and national governments to develop laws and policies that promote social economic inclusion of refugees. And for instance, the government of Kenya has reignited discussions on the CRRF, and there's also a refugee bill that is in process in the parliamentary process in Kenya. Thank you so much, Bart. Over to you.
All right, thank you so much, Ms. Simiyu, for your useful reflection and critical leave, also for having touched on the particular situation on stateless populations. Thank you so much. Now we are very pleased to now welcome Ms. Tamara Maximovna Inzutova, who is an internally displaced person in Ukraine and serves as an active community member in the local civil society organization called Good Deeds Foundation in the town of Ipin. Ms. Inzutova, the issues faced in internal displacement situations are very often aggravated for older people. And the eruption of the COVID-19 pandemic in Ukraine has brought as well an additional layer of risk and isolation for older people who are already among those at most risk in this pandemic. On the other hand, older people have strengths and capacities that have been built over the years and through their experiences. I would like to kindly ask you to share your experiences during these difficult times and tell us how the COVID-19 pandemic has affected you personally, your family, and the members of the displaced community in the town of Iping. And what were some of the challenges you faced, and above all, how have you been able to contribute to your community? Ms. Maximovna Inzutova, please, over to you.
Добрый день.
Hello.
English.
Which deal with providing assistance to the displaced people during COVID-19. My name is Tamara Maximovna. I'm almost 70 years old, and I've never thought that once I would be invited and I would have the pleasure of sharing my experiences with High Commissioner about the displaced persons in Ukraine. This is a great honor for me. Today I would like to tell you how COVID-19 pandemic affected my small family and the members of our small community of displaced persons in Pen. My husband and I, we've been living as displaced person for over 6 years, and for the majority of the displaced persons, all their savings and all their income goes for rental income, which we don't own, but we rent. But this year has brought even new challenges for my family. My husband had a stroke, and he was diagnosed with cancer. So the whole situation was quite stressful and bad. But now with COVID-19, it has added more stress. During the self-isolation, we were completely isolated, no contact whatsoever. We couldn't get any support, any medical health assistance, and it also affected other old displaced people. In order not to get infected, they stayed in, and the elder people quite often, they don't have internet, they don't have smartphones. Some people even don't have old button phones, and they don't have sometimes money to pay for the phone. Some of my friends, they haven't been out for a month just to throw out the rubbish or to buy food. We didn't have masks or sanitizers. We were afraid to get support from the volunteers because there would be a personal physical contact. The medical assistance and support which is required by the elder people was interrupted, stopped because of this isolation. So we were almost absolutely desperate, but despite all of this, the light at the end of the tunnel was our friendship with the charity. In 2019, the UNHCR opened the Center for the Displaced People in Irpen. It combined internally displaced and externally displaced people. We had new soul friends, and during the discussions over the cup of tea, we started to teach our children to our hobbies: sewing, cooking, drawing. And in 2020, during the pandemic times, we had more support and attention. The volunteers started the program How to Feed Elder People During Quarantine. So the team spirit supported us in order to start sewing again and to support each other, because the masks, they were quite rare. It was almost impossible to get one. There were only few of them. The price was extremely high for the masks, and we decided to make them ourselves. This is one. So at the time when the head of the public organization didn't feel well, we tried to coordinate our efforts in order to make more masks. So our hobby became our support line. We created a lot of creative masks for children and adults. We dished them out for anyone who needed them. So sewing the masks had a positive psychological effect because our team and ourselves, we felt required and useful and busy, and we also participated in the competition for the best designer mask for the face. So the history of my life proves that only together we can overcome the pandemic or any catastrophe. Anyone can contribute something. It is very important to see the potential in any person and to support their ideas. And I would like to say that it is so important to feel oneself useful and to do at least something in order to prepare for the prophylaxis of the virus. And I'm sure we will overcome all these challenges. And I would like to say as well that the pandemic has made it even more important for the displaced people to have their own accommodation, and to become the member of the community. Whilst the local inhabitants are supported by the local government, the displaced persons remained invisible to them and forgotten about. And that's how we learned that for older people, they received some food packages. We didn't receive anything. Maybe the displaced people forgot to include the displaced people in the list. We left our houses behind. We moved. We are displaced. We don't have anywhere to go back to. We have to rent the accommodation. But it's important for us not to be forced out and to have the permanent residence. And I believe that the scientists will find the vaccine and the remedy for this virus. But we should also not to over-evaluate the support from the simple people. We understand our necessities and needs and how they can be solved. We can listen to each other, to find solutions together, to do what we can. That's what really, really is important. Thank you for this opportunity to share my thoughts, and thank you for your attention.
All right, thank you so much, Ms. Inzutova. Yeah, thank you so much, and I can see you are doing really great in your community. Please keep it up. I can see even the face mask. Well done. Thank you. And now I would like to hear directly from a community volunteer in the Zaatari refugee camp in Jordan, Miss Ala Ali Al-Qasim. Miss Ala Ali Al-Qasim was born and raised in Daraa, Syria. In 2012, Alia's family fled to the Zaatari camp in Jordan. And in 2016, Ala was granted a full scholarship to Al-Zarqa University to study press and media, where she graduated in 2019 at the top of her class. She has worked in the Zaatari camp as a psychological and social support activity facilitator and as an outreach volunteer to identify separated, unaccompanied children and foster families. Ala, could you kindly share your experiences as a young, ambitious person, and how did COVID-19 affect you and other youth in the Zaatari camp? And what were some of the challenges you faced? And above all, how have you been able to contribute to your community? Miss Ala Al-Qasim, over to you.
Good evening, everyone. I shall tell you how COVID-19 has affected the refugee community. At the beginning of 2020, the Jordanian government decided to have total lockdown, and the doors of the camp were shut down completely to save the refugees. But there were people from the UNHCR who were working there day and night to save the refugees. Now, there were basic There were basic services that we carried on, such as security, health, and shops that carried on working, but we still managed to keep in touch with all the safety requirements. There were some services that were finished, such as nurseries, the courts, schools, and the office that gives issues the work permits. Suddenly, overnight, the life of the refugees changed totally. There was no other choice except that they had to adapt to the new norm, really, when it comes to education. For example, we had to learn from distance, which has positives and negatives. The positives, that education carried on, but from the negatives, because the internet was poor and the economic situation that the families were complaining about meant that they couldn't buy gadgets and equipment for the children, even though there were internet bundles and smart equipment that they were given to the children so that they would cover things covered at the school, but they didn't have enough to cover all the children in the same family. Now, when we look at the refugees who were actually affected by corona, things such as total lockdown. There were some works, some jobs where people worked in cafes or petrol stations and on land. It meant that they were unable to go out because of total lockdown. Now, this was done because it needed to protect the refugees, but it also affected them financially because they rely totally on that income. So now the only income that they had after this was whatever finance they got from UNHCR. Now, the situation of the refugees, because of the lockdown and social distancing and having to wear the mask and the carry-on, because they were following all the instructions given by the news in Jordan or with the UNHCR, it meant that the COVID wasn't spread that much. Now, that meant that the refugees moved to a new norm where they had to learn totally through the internet and all social media platforms, because that was the only way where they could communicate with others and receive information. Now, despite all the difficult economic situation that the refugees were living under this catastrophe and all the psychological pressures as well, that didn't mean that the youth didn't actually try to serve their community, for example, because I studied media and I wanted to write a few articles to discuss the success stories of the refugees and also the challenges that they face. Some of them are the initiatives that were carried out by the young people and also empowering women and education. Now, when we talk about innovation, I wrote a report that talks about the innovation of the youth when they talked about studying remotely so that COVID wouldn't spread anymore. Now, this idea was explained to all other societies so that the benefit would be for all. I also wrote an article about 2 female engineers who were second when it came to International Excellence Award when they designed a house that would be used to reduce the spread of corona, where they actually used building materials that are easy to sterilize and to clean. Now, other reports I wrote about was about youth and technology. Because we live in technology era, many of the youth in the refugee camp used the platforms to serve the community, because they actually had pages on Facebook where they had educational materials and they were teaching English to those who needed to. There was a school that raised awareness when it comes to health issues. I myself also wrote a few stories on success stories of refugees within the camp. Additionally, one of the initiatives that we launched through this was the distribution of internet cards to university students so that they'd be able to carry on with their exams remotely. Other initiatives as well for youth within the camp was launching an initiative of giving stories and gifts to children who were mostly affected through corona, so that they would have more happiness in their lives. One of the important things that I wrote about was the role of women in COVID and also how gender issues had to be focused on, especially now. Now, for educated women, they started to teach from distance, teaching their children from home. They were looking for strategies to teach them through using the internet for resources, in addition to carrying on with their housework. Now, the problem was women who weren't highly educated because they couldn't teach their children, for example. Some men weren't helping those women when it came to teaching their children because they expect that it's not really for men, it's only for women. But educated women participating in having networks, virtual networks, to teach children within the community. This is because they think education is the gate to our future. Now, women also had a role which was very important in supporting the women in the same society by teaching them handicrafts, how to make soap, for example, through platforms. They also gave lessons for skills, life skills actually, so that they would learn how to practice activities with their children to reduce all the psychological pressure they are going under because of lockdown. So the role of women in COVID was really, really important in reducing the psychological stresses they were under. One of the topics I also wrote about was education when it comes to children. So education, it's to support education in children. And through that education, we taught them as well how they could apply to go to universities and how they would use the certificates and degrees that they get so that they would learn later on in proper schools, and also how they would be able to go to vocational programs as well. Thank you.
All right. Thank you so much, Miss Al-Kasim. It's really great to hear about the work that you and other young people are being engaged in. For your information, we are doing the same field of interest. I'm also doing journalism and media studies. I would like now to turn to our last speaker. We are very pleased to welcome Miss Devi Maya Gurung, President of the Bhutanese Refugee Association of the Disabled. Ms. Gurung, COVID-19 has had a severe impact on refugee women and girls who have been disproportionately affected by gender-based violence. Women and girls with disabilities are particularly vulnerable to these risks and face additional challenges to access services. I understand that you've been supporting women and girls with and without disability in your community to access GBV prevention and response services before and during the pandemic. Would you like to share your views on the opportunities and challenges to consider in this regard? Ms. Devi Maya Gurung, over to you.
Thank you so much, Aina.
Thank you very much. Thank you very much for giving me this opportunity in this session. First of all, I would like to thank you for this. My name is Devi Maya Gurung, and I am the president of Bhutanese Refugee Association of the Disabled. I came to Nepal in 1992, and from then onwards only, I have been very active in Bhutanese Refugee Association. I have been continuously working in this field, and also women empowerment is also like my field where I have been engaged for a very long time. And when it comes to Bhutanese Refugees Association of the Disabled, it's been 7 years that I have been working in this association. I am very, very happy that I am representing this community, Bhutanese Refugee Association of the Disabled Women and Children, and that I'm amplifying their voices in this platform. So this opportunity to amplify their voices, I am very, very happy for giving me this opportunity. Especially during COVID-19 or due to COVID-19, it is worldwide. It has made worldwide impact, and it's not only limited to Bhutanese refugees. But if you talk about only in concern with Bhutanese Refugees Association, all I would like to say is I think the refugees all over the world have been impacted with this COVID-19 pandemic. But if you come to only Bhutanese refugees, then what I will say is, there was national lockdown, nationwide lockdown, due to which Bhutanese refugees found it very hard to earn their day-to-day livelihood. For example, the kind of impacts they faced was about food. Like they could not, the price had gone up, had increased of even the basic food even the basic food. So because of which, like, they could not also be able to feed their children properly, children and their families. So this was one problem. The other problem is that, like, the Bhutanese refugees who were disabled, children and women, and from other communities also, they could not even commute. They could not even go to the hospitals also. And also their income source was which was making, for their daily living, had also been limited. Like, they got even more less options. So in such situations, and during COVID-19, those who were economically, socially very at the bottom, they also faced with gender-based violence, like domestic violence, where they had to face domestic violence because people with disabilities, they are mute, they cannot hear, and they have to use sign languages. But not all of them will be knowing sign languages. Not all of them will be able to comprehend what sign language is about. So because of that, the communication got difficult. So that also increased their vulnerabilities. So in that, especially if you look at the children with disabilities and women with disabilities, then, like, sexual gender-based violence had increased. But despite of what they had to go through, what we have to understand is, like, the reason behind them going through such situations, like organizations like the LWF, UNHCR, the organizations who work with refugees, they have been, like, supporting, they have been overseeing us, and we could not have direct communication with them in person. So that also hampered our level of communication with people who could provide us the support. The women with disabilities who are bedridden, who cannot move on their own, they were even more, they were facing even more difficult times. Like, they did not have access, or they could not get food from the relief packages that were being offered. Also, like, they were confined in the house, and then so their drunkard husbands were beating them, so domestic violence cases was also there. And it was not only limited to that, but due to pandemic crisis, their communication, like, they could not read the news, they could not get the news, so their psychological stress increased, so their mental health was being affected. There were people with mental health issues. They could not even go to public hospitals due to lockdown because of COVID-19, because those hospitals were also closed. So at that time, like, the money, the medicines for the money and medicines for their mental health medications could not be accessed, could not be availed to them. So they could not get proper health services. They could not even, like, first it was difficult to go to the hospital, but during COVID, these are the challenges that we have faced. There were many challenges, and there were many things that they could not do. They could not move around, they could not maintain their hygiene. They were, like, without their family, they were living on their own, and they were feeling more isolated because they were lonely, and they had difficulties with maintaining their hygiene, daily hygiene, and also there were shortage of food. So during that time, UNHCR provided support, like some financial support to the individuals who were in very dire needs. So while that support was being extended, other individuals, other refugees also were in need of those kind of support, and UNHCR did provide support to both of them, both of these kind of individuals. Also, AMDA Nepal also has been helping us in terms of health issues. They also provided support in Damak municipality. They coordinated with Damak municipality, and then so when we were, like if we were sick, then they provided us help to go to the quarantine shelters or to go to the hospitals. So those kind of supports were received, and even in such times, the kind of good things that we did, positive things that we did, is that we call it CBOs, which is like camp-based organizations. There are like BRWF organizations like BRWF. They first identified the women who were going through domestic violence. And so these women who faced domestic violence were counseled. Those who had gone through SGBV, sexual gender-based violence, they were also counseled. And then we also coordinated with other organizations. And so they also provided us with suggestions, and we took those suggestions in relation to children with disabilities, women with disabilities, and then we worked with municipalities. Then we have Bhutanese Refugees Association diaspora in foreign countries outside of Nepal. So those diaspora also helped us. They provided us with basic help for the Bhutanese Refugees Association in Nepal. We coordinated with the Bhutanese refugee diaspora, and we received financial support from them. So they also established a financial fund, and then we received their money. And then with that money, we could buy the food, and then we could distribute it to our members in the society. Also, like I've already said, there are like camp-based organizations like BRWF, CMC, which is Camp Management Committee. So we provided them. We had already in our community, we've already created a system which actually looks after the women and children who have faced sexual gender-based violence. And during COVID-19 also, we kept in mind about physical distancing, social distancing, and then so we tried to see like what they can be engaged in, whether it was mask making, whether it was bamboo crafts, whether it was weaving bags, weaving bamboo things. And then so we went to their houses, we encouraged them to produce those crafts, and then we would sell those, and then from the money that we would receive from those, it would go to the community fund, and that community fund would be used to help the individuals who are most in need of such services. That is how community fund is being used. The other thing that we have done, the positive things that we have done, is that in our every CBOs, there is one focal person. And then, like I've said, BRWF, which is Bhutanese Refugees Women Forum, that completely focus on the women who are like Bhutanese refugees women only. And then, so if any women, like the moment we come to know about anyone facing SGBV, then we coordinate, and then we try to give psychosocial counseling. We do house calls, and then try to find out what are the difficulties that they have faced. Also, there is Safe House. Safe House is for the women who have undergone domestic violence. But if such cases happen around midnight, then we take those women to the safe houses also. We escort them, and also we coordinate with them. We create a session for family counseling. We create session for environment for mediation.
Yeah,
also during
Mr.
COVID-19, what we have done.
Miss Davis, Sorry, thank you so much. I think you have a lot to say, but please, time does not allow us. But I hope that we will come back to you. But first of all, I would like to thank you for sharing your experiences and highlighting the needs to address the additional barriers faced by women and girls with disabilities. Do not worry, we'll come back to you in the session of questions and answers. I think now we have some 40 minutes in front of us for questions to our 5 distinguished guests. And I confirm that your questions were already submitted through the registration form. You are welcome to head your questions to the chat box. We will try to address as many as we can. Let me now start by asking the first question to Miss Ala Al-Kasim. Ms. Ala Al-Kasim, this is just a follow-up question to what you said. In your initial remarks, you mentioned the particularly heavy burden on women during the COVID-19 in terms of both managing the household and children's education. Do you have any other suggestion on how men and husbands could be encouraged to take a more active and equitable role within the family? I assure you that I have a pen with me here and I'm going to put it into practice. Miss Ala Al-Kasim, over to you.
In my opinion, there are many parties that could take part in this, starting with through relying on auto-reliance, self-reliance, and also by carrying out meetings with people who support the role of women in society, where they would show us how this would actually stabilize the families, and also by looking at the society itself, where we can have campaigns where we would gather signatures that would support the role of women and equality between genders. Also, when we look at imams and sheikhs at the mosque, where we look at how they emulate the Prophet, who used to teach his wives well, and also when we look at service providers, where they raise awareness that look at gender roles and also equality between genders and the importance of supporting the women. Especially all of these should be directed at men. And thank you.
Yeah, all right. Thank you so much. I took note and I assure you that I'll put it into practice. I'll make sure that we support women and girls in their work. So let me now come back to Miss Maria Fernanda Ceballos. From your perspective, why should states adapt their national asylum systems in the pandemic? Miss Maria Fernanda Ceballos, over to you.
Muchas gracias, Bart. Bueno, en el Ecuador, el Estado garantiza los derechos de las personas independientemente de la categoría.
I cannot hear you. Yeah, can you now speak?
Hola.
Right. Yeah, I can now hear you. Great.
There's an issue with the interpretation.
En el Ecuador, el Estado
In Ecuador, the state guarantees the rights of the person regardless of their migration condition, and access to rights cannot be suspended or paralyzed despite the current circumstances we're experiencing. The state is responsible for establishing policies and facilities and the technical equipment. We have to provide the materials so that our authorities can make the best decisions possible. The COVID-19 pandemic has meant changing the way we do things and has paralyzed us as a human race. But despite that, states should continue to strengthen our response capacity, and as people and administrative staff, we also need to continue working. As institutions, we have a number of competencies and area of expertise. We also need to work in a coordinated way with others to ensure our ability to respond and to ensure also that every institution fulfills its duties. And I mentioned this in my first speech. For Ecuador, within the framework of the pandemic, one of the main priorities is to help children and adolescents. And this was only something we were able to achieve by coordinating with civil society organizations, with NGOs, and of course, with the help of the UNHCR. And I think that we are living in an era where technology can help us a lot. And this isn't a cliche, this is a fact. And a lot of the decisions that we've been able to take in Ecuador have been thanks to technology. For us, having the Progress V4 system has been crucial because it's allowed us to have access to information in real time, and we've also been able to access the database to input new information about applicants. The challenge will always be to improve our response capacity. As states, we need to consider that access to technology is a priority. It will allow us to continue with everyday life. Thank you.
All right, thank you so much for your answer. I think I would like now to come back to Ms. Devi Maya Gurung. Yeah, I understand that during this pandemic, almost everyone is staying at home. Men, women are just at home. But now violence against women and girls has increased during this pandemic. In your experience and as reviews of women and girls in your community, which type of interventions have been the most successful, and why should it be prioritized in the future? Yeah, Ms. Devi Maya Gurung, over to you. I think while we are trying to fix the issue
we're fixing it.
I think we can move to Ms. Leila Militiu Simiu, yeah, at least to have some of the response in this question. So I would like to ask you, why are inclusive approaches to access to services so critically important to refugees and stateless persons during a pandemic, and what have been the key achievements in this regard? Ms. Leila Militiu Simiu, please, over to you.
Thank you, Bart, for that. So refugees and stateless persons must be included and consulted in decision-making and interventions because they are key stakeholders and they contribute to suitable solutions to the challenges they face. So inclusive approaches are very important because the negative impact of the pandemic cannot be addressed if some members in the community are excluded from information and access to services. So when it comes to achievements, in terms of stateless persons, information sharing, this was done, especially when it came to Ministry of Health guidelines, and it was done on various platforms like radio shows and text messages. And communities, the stateless communities were informed to tune in to the radio station so that they could listen in for themselves what exactly the government was saying or other agencies were saying when it came to issues to do with Ministry of Health guidelines. And why this was also important is because a lot of stateless persons, because of being excluded from services and generally from the community, some of them actually said, and they felt that some of the social distancing measures and the medical measures that were brought in was because it was a way to discriminate against them. And that's why it was very important to include them from the onset, so that then they can feel part of the community and part of the solutions that need to be there when it comes to addressing the pandemic. In terms of education, the classes were done online because the schools were closed. And this required children to acquire smartphones and laptops, which was not possible. So the only alternative that was proposed by the stateless persons was to tune in to radio stations for the classes. And they were able to be provided with radios, so then the children could be able to access education. So stateless persons should not be left behind in access to education, as it would be very difficult for them to catch up with their peers at later stages. In terms of access to health, stateless persons who are suspected of being COVID positive, were quarantined, and the government was able to cater for their expenses. And those stateless persons who are in detention, detained before the COVID cases came up, were released unconditionally by the government from detention areas, so that then to reduce the issues of infection. Post-community relations, we saw quite a bit of support for stateless persons by host communities. For instance, we had even heard of cases of government officers through their own personal initiatives who continue to pay school fees for children from the stateless community. We had even other government officials who, from their own personal resources, even purchased food for 150 stateless persons during the COVID period. For the refugees, communities sharing information, refugees were informed and they were aware about the critical role they played in addressing COVID. So in this regard, refugees in the refugee camps were able to identify new arrivals and relay the information to UNHCR and government officials, and such new arrivals were then placed in quarantine and tested. In terms of provision of PPEs, again, refugees were very aware about the role they played, the critical role they played in terms of provision of PPEs, and even themselves were able to provide those PPEs themselves. Some of them even used locally available materials to make masks and soap, and they provided that to other refugees and the host communities. We even had some refugee youth who used their own money and purchased food baskets for their neighbors. In terms of engagement with community workers, continuous engagement was done, and the community workers themselves, who are both refugees and from the host communities, requested for tools to enable them reach out to vulnerable members of the community, and so that they can also be able to relay information related to COVID-19. But then it was also as a way that they informed us as a way to be able to reach out to survivors of sexual and gender-based violence, because there was also an increase in terms of sexual and gender-based violence cases in the communities. So these tools that they mentioned were, for instance, mobile phones and mobile data bundles. But also agencies were able to share their contacts with communities to ensure that all services were reached and available to all. In terms of community engagement, there was a lot of discussions and engagement with chiefs, local leaders, and refugees, and also ensuring that there was representation in terms of age, gender, and diversity to ensure that information and the communities were able to share information about what was happening on the ground and how they themselves wished to be supported during this period of COVID-19. And from these discussions, for example, in the urban areas, the urban refugees proposed that for those who are not able to live in the urban areas because of the negative impact of COVID-19 on their livelihoods, then relocation to camp would be an option, so that then they could continue receiving services and reduce the negative effects of COVID-19. In terms of contribution to medical care, refugees, where possible, contributed to provision of medical services. We have a refugee who is a medical professional working in a main hospital in Kenya, and she was able to provide medical care to all persons. And she was also able to sensitize communities, both host communities and refugees, in terms of prevention and management of COVID-19. We also had other refugees who were able to compile statistics for the COVID-19 cases, which contributed to government planning and response. So all in all, refugees and stateless persons are not a burden. They are a huge asset to the countries that host them, and the inclusion is imperative in addressing the impact of COVID-19. Thank you, Bart, and over to you.
All right, thank you so much, Lisa, for raising the importance of inclusion of refugees and stateless persons. And I'm really happy to hear that stateless persons, refugees, they are not abandoned. Thank you so much for your support. So let me now come back to Miss Devi Maya Gurung. Are you back with us?
Besides me and my friends, what I have been saying is that women with disabilities, refugee women and children with disabilities, they were in vulnerable position. And at that time, what we did was, like, women and children with disabilities, we conducted like public awareness campaigns for them. It was related to sanitation at the time of Corona crisis, how to remain safe by yourselves. So we used Facebook, online mediums, and then we made house visits also while maintaining like physical distance. That is how we made them, we aware them on the problems and how to remain safe. When it comes to sexual gender-based violence, what we what happened is, like, you know, we also focused more on livelihood, like earning for livelihood. Also, when it came to sexual gender-based violence, we have received many different kinds of trainings, and from UNHCR also, and there is case management trainings also we had received, and also how how women with disabilities, children with disabilities can be protected or prevented from SDBV cases. So we had been conducting such programs before also. And during the crisis, like for these women and children with disabilities, what we did was like we conducted inclusive training programs for them also. For women with disabilities, we formed a self-help groups which focused on income generation for their daily livelihood, which was funded by UNHCR and which was implemented very well. We brought it into practice, and there were like brothers and sisters who were not left behind. We included them. We were working in group. There were self-help groups. And then we practiced including them. So with that, there were loads. There were like poultry farming, animal husbandry. We practiced that for GBV survivors. We also included like family survival skills, because of which they could do like their works like pickling of mushrooms, like producing handicrafts. Those kind of works we focused on. We focused on imparting those kind of skills to them, sanitization, hygiene, and women who could not do these things by themselves, we visited them on our own and provided a lot of support to them. And it was not only us, but the organizations also. Whatever we had learned from the organizations, we transferred it to our community members. Like, for example, like there's Damok municipality, which always coordinates very well with us and provides us with support and security at times of our need. Thank you.
Yeah, all right. Thank you so much. Thank you so much for sharing at least these positive ideas on this platform. So let me now turn to Ms. Maximovna Inzutova. So I understand that the use of technology and the internet to access key information during the pandemic has been very important. So what would be your advice to make sure that all the patients have access to timely information on how to protect against COVID-19 and what services are available? Ms. Maximovna Inzutova, please, over to you.
Thank you very much, Bartosz, for this question. I would like to say that for older people, receiving information just from the internet would not be very effective. It's very difficult for them to use smartphones and computers, and we are afraid to break those devices, and we only use button phones. And it's also quite expensive because you have to pay for rent, you pay for food and medicine, and only then you think where you spend the rest of the money. Older people are used to watching TV and read newspapers and read leaflets. So the best way to provide this information is through TV channels or through leaflets, where information about the phones and addresses would be provided, and volunteers could provide those leaflets, and you could keep them handy, and you can ring the relevant service when you need help.
Yeah, all right. Thank you so much. I hope, thank you so much for sharing again these beautiful ideas. So let me now go back to Miss Leila Muritia Simiyu. I understand that humanitarian actors, they are playing a key role during this pandemic, and you are the only panelist here representing an NGOs. Can you tell us something about the role of your organization is played, and why the engagement of NGOs and civil society generally is critical in response to this pandemic? Ms. Leila Muritia, over to you.
Thank you very much, Bart. So RCK, the Refugee Consortium of Kenya, is a local NGO, And what we did during the pandemic is to provide remote legal and counseling services. So we used virtual platforms and mainly telephone calls where possible, and especially for survivors of sexual and gender-based violence, we had physical interactions, but observing social distancing. In terms of mental health, refugees increasingly requested for more information on how to manage stress and anxiety because of the COVID-19 situation. So RCK then was able to conduct psychoeducation forums where possible, while other information was also shared on telephone and through text messages to their communities. In terms of legal counseling, we provided information on the new virtual court system with the refugees and stateless persons, and in terms of how to navigate around the court system because it was a totally new concept for them. For survivors of sexual and gender-based violence, we provided laptops at the police stations so that they could be able to log in and provide testimonies for their cases virtually. Then in terms of court representation and police station visits or monitoring, this was done virtually, and we're able to secure court orders for cases. When required and when physical restrictions were eased, the matters were attended to physically. In terms of at the police stations, we're able to provide dignity kits for women because for a lot of women at that time, the first point of call because of the lockdown and the curfew hours, they would rush to the police station, and many times the police would be caught off guard because someone maybe doesn't have, they only ran away with the clothes that they had on their back. So we're able to provide at least the dignity kits for the police to be able to hand out to the women when they were there. Then we're able to monitor implementation of laws to ensure that persons of concern were treated the same way as other persons and that they would not face any harassment. And in this regard, we did training of government officers, and especially when the restrictions were eased, while observing the social distancing directives. This was because protection in the asylum sphere must not be watered down because there is a pandemic. Then we also were able to share information on health and security as per the Ministry of Health guidelines, and also as per information that was being shared by UNHCR. Because of the negative impact on livelihoods of refugees, we were able to share and give out social assistance to persons who needed to pay rent and to buy food, and also able to provide grants in the form of goods to enable persons to restart their businesses, and especially those who are affected by the pandemic. Debriefing was very important for the community networks that we engage with, because they are also in those particular situations and seeing other people suffering. So it was very important to look at their mental health and also the mental health of the staff. So in terms of the critical role of NGOs and civil society, one is the provision of life-saving services, because this is an essential and critical role, especially in contexts where health facilities and other protection facilities are strained or they're under-resourced, or maybe because of the pandemic, the resources and the services, the health services became strained. Then also NGOs and civil society filling assistance and service gaps that the government is not in a position, due to various reasons, is not in a position to provide. And some of these gaps to be filled include food, medical supplies, among others. Another critical role during the pandemic for NGOs and civil society is linking up persons of concern with services. Often, persons of concern may not know during a pandemic where and how to seek services from the government, from NGOs and civil societies. So that linkage is very important for civil societies to fill in. Then monitoring of laws and policies, that is a critical role that NGOs play, and that would ensure that the provision of government assistance is provided for all persons and there is no discrimination at all. It also involves monitoring the asylum space, where, for instance, new arrivals are being allowed safe access to seek asylum, among others. Another role is advocacy. To ensure protection of persons of concern, advocacy sometimes may be required with government bodies to ensure that they encompass and include persons of concern in all recovery and rehabilitation plans from the pandemic. And then lastly, provision of technical assistance. This includes NGOs and civil societies supporting governments to, for instance, develop plans that are inclusive of all affected persons and even those that may be affected from the impact of COVID-19. It may also include development of laws and policies. Thank you, Bart, for that. Over to you.
All right, thank you so much for raising the roles that NGOs and civil society should play during this pandemic. Let me now turn to Ms. Maria Fernanda Ceballos. Let's talk now from a preparedness perspective. In your view, what should states prioritize in their contingency planning for similar crises, including with regard to documentation services? Ms. Maria Fernanda Ceballos, over to you.
Muchas gracias, Bart.
Thank you very much. Bart, can you hear me?
Yes, I can hear you.
Hear me?
Yes, 5 by 5. You can go ahead, please.
Bueno.
Okay, so from the experience we have in Ecuador with regards to human mobility topics, and here I'm not going to just talk about the foreign people who are here in our country, but also to the important number of Ecuadorian citizens who receive who are living abroad. We have made important, efficient decisions. I would like to dare to say this, the decision of improving and updating the information using the tools, the technological tools. It is a required investment that states should make gradually and obviously taking into account the necessary budget investment as much as they can afford it. Obviously, with that, you generate some kind of a security sensation in the citizens because they know they can access this information. And also, let me tell you what happened with the documentation. Before 2018, we had plastic documents with some kind of safety measures where we used to print the pictures and the information of the asylum seekers. This would generate an important expenditure for the state. When we thought about generating the electronic visas for the other type of migration categories, the request we did from this department was to include people with need of international protection in this electronic visa system. That was a very important and timely decision. At the moment, visas arrived to the personal emails addresses both of the refugees or asylum seekers or the stateless who had been acknowledged as stateless people. And people can bring this out as many times as they need, so they can have this document ready. Also, in order to access these documents, any person from the iPhone or their phone, they can download the app, and with information, they can access to see if their visa is valid or not. Also, they can download the visa in their phones, in the mobile phone. I was listening to one of the panel members. I was reflecting upon the situation of the elderly. It is true, we have these digital gaps that they need to be addressed. Well, we had established to access documentation for these people. And for those who are illiterate, who cannot read or write, was to print out the document on our offices as many times as the person needs this document. These are documents which have some security measures. They can be read out digitally, electronically, but obviously there are some people who prefer to have a paper document. Some of them, they need to carry that document in the wallet. But with that, you have the possibility of giving them other possibilities, and we have to think that not everyone are the same and they have different needs, and as a state we are here to give them access to information, to their documentation. The humanitarian visa and the international protection visa, as we have said, they are electronic type visas, and we also have in our web page the forms to access the procedure and to different admin processes within the framework of this procedure, which is very important. And also the international protection visa for the stateless people or asylum seekers give the person a sort of the right to have an identity card. And with this document, the person can go to the civil register of the Ecuadorian ministry to have access to an identity card, which is the same document the people who are Ecuadorian nationals have access to. So this has been a very important decision. This has been a very, very important decision that the Chancellery has adopted, the topic of the electronic visas. I'm ready if you have any issue. And it is important that you know that these decisions had been made before the pandemic. Somehow, we were preparing ourselves for this scenario. And I think that's what the states should do. This is our duty as governments, as states, to see, to foresee the future, to check, to monitor the future and the needs of people and how we can really improve our response capacity. Thank you very much.
Yeah, all right. Thank you so much, Ms. Maria Fernanda Ceballos, for talking about the preparedness perspective and to put on more emphasis on the documentation. So let me now come back to Ms. Maximovna Inzutova. Ms. Maximovna, beyond the impact on basic services, I mean the impact of COVID-19, what was the impact of COVID-19 on the mental health of older persons? Ms. Maximovna, over to you.
It was very scary and difficult for people to stay in-house, to stop communicating as we used before. The situation with the pandemic, it affected us a lot. And from personal experience, I would like to say that it's very important, the hotlines for psychological support, where you could ring and talk to someone, to talk about your feelings. Also, the volunteers helped us a lot. They organized group calls for us, so we were not forgotten. They would call us, ask us how we're getting on, what we needed. And as I've said before, previously, it's very important to be busy with something and to be useful. So sewing the face mask helped us psychologically, and they were useful to other people, Bath. And now I'd like to give the floor back to you. Thank you.
All right. Thank you so much. Let me now turn to Devi Maya Gurung. Lockdowns and other measures adopted to fight the pandemic have had a serious impact on the psychosocial well-being of refugees, including women and girls with disabilities. So now, based on your experience and views of women and girls with disabilities in your community, which type of intervention should be prioritized in the future? Ms. Devi Maya Gurung, over to you.
Thank you for the question.
Thank you for the question. मैले चाहिँ के भन्छु भने what I say is that when you are prioritizing the issues like women with children and women with disabilities, children with disabilities, they need to have social security. And right now in situations like this, you know, like the technology is being used video conferencing, online meetings to understand their problems, to navigate what kind of support can be given to them. So those kind of issues need to be mapped, identified and worked on. There is a lot to do in this sector, and Nepal government also, like Nepal government's local government sectors in local level, they also need to be aware to include women with disabilities, whether they are refugees or not. Also, like women with disabilities who are more vulnerable, who have faced SGBV they should also be treated equally. They should also be included equally, so that they can be consulted, they can give informed consent, and also like voice what their problems are, and then only they can be empowered to raise their voices, to represent people like them, and get help as well as help people like them. So when you are conducting such programs, there will be women with disabilities, children with disabilities. There will be women who will be facing SGBV. So we need to think of sustainability. We need to think of longevity of the programs or the support that we want to give to them. Also, when we are carrying out such programs, for example, UNHCR provides psychosocial counseling in mental health cases. So this psychosocial counseling should continue. Also, like there will be there will be individuals who will have specific needs, who will be more needy than others. So those individuals should be insured, provided with insurance by the government, and that should continue, and that should be the priority. That is what I say. Thank you very much once again for letting me to share my problems, problems of my community, and the responses that I've received in this forum. Thank you very much. Thank you very much for this opportunity.
Thank you so much, Ms. Maya.
धेरै धन्यवाद.
Let me now turn to Ms. Ala Al-Kassim. Now that COVID-19 has affected so many aspects of our lives, what message or advice do you have to other girls and women who would like to realize their dreams? Ms. Ala Al-Kassim, over to you.
I
would encourage everyone and every girl to stand by her ambitions and goals despite all the hard difficulties that they face and all the challenges they face. This is something I say at all times. I would say, let success and excellence and achievement be your support. Don't let your social status and your conditions stop you from reaching and achieving your goals. Always learn and take all opportunities to improve your skills and experiences through joining courses in all aspects and all fields. Remember that education is the gate to future and success. When you learn and you teach your children, you provide job opportunities for yourself, and you also serve your community. Remember, you are always exceptional, that you were found on this world so that you would actually pave the way to others. Thank you.
Yeah, all right. Thank you so much, at least for guiding youth who are taking you as an inspirational youth. Yes, I would like now to turn to our 5 speakers to, in 1 minute each, I say again, in 1 minute each, to ask like what are key recommendations that they would like to share with us before leaving today. I would like to start with Miss Tamara Maximovna Inzutova. Do you have any recommendations around strengthening community-based support and social protection for older persons in displaced settings? Ms. Tamara, over to you.
Thank you, Barth. Thank you for this forum, for this meeting. I would like to say that it's very important to remember that it's very difficult for elderly displaced people. You need to support their initiatives. We can do a lot ourselves. You should see the potential of these people, to support them, support their ideas. And thank you very much for this meeting and this opportunity to share my ideas. Thank you.
All right, thank you so much. It was a pleasure to have you. Let me now turn to Ms. Ala Al-Kassim. Can you give any recommendations on improving gender equality and youth empowerment? Ms. Ala, over to you.
Yes, I will talk based on the experience that I had working with the youth, women and girls in my community. I think there are many ways that we can talk about when we talk about gender, so that we would have equality between them and to empower women. Now, there are a number of recommendations. I start off when we talk about university scholarships. It would be very good when there's actually an increase in supporting young people, especially the females, when we give them scholarships, because we actually have a lack of scholarships and the fees are quite high. And this in itself itself depresses young people, and all ambitions is actually thwarted that way. So if we give an increase in university scholarships, especially for women who are over 40 years of age, because that gives them empowerment socially and educationally and also financially. Now, jobs. Many young people actually graduate from university but are still unemployed, which causes a huge problem. Now, despite all the UNHCR an organization giving them opportunities, this isn't actually enough for those graduates. So I hope that there would be an increase in providing jobs for young people, especially for women who are actually more vulnerable in the society, and that way we give them financial empowerment so that they would take their skills and they direct it to support their society. Third, innovation. Now, despite having an innovation lab within the camp, but there are certain spaces now, so they need materials as well, but these aren't enough. So it would be great if we are able to give them wider spaces and more materials and equipment that would support their innovations, in addition to having specialists who stand next to them that would give them direction and mentoring so that they learn how to use this equipment and they can improve their innovations. Now, we have the young people who live there actually have a lot of ideas and innovative ideas, but they need more support. I would like to thank you again for giving me this opportunity and for allowing me to speak.
All right, Miss Ala Aukasima, thank you so much for being here with us. Let me now turn to Miss Devi Maya Gurung. Do you have any recommendation around improving access to technology, psychosocial support, and health coverage for refugee women, girls, men, boys on an equal basis with others? Please, Miss Devi Maya Gurung, over to you. All right, thank you so much. I think we're facing the problem of internet connectivity. I don't know if it's the problem of interpretation or maybe if it's coming from Miss Devi Maya Gurung. Yeah, I think now I would like to turn to Miss Leila Muritia Simiu. Can you share any recommendations? Yes, Miss Leila, I think I would need to come maybe back to Miss Devi Maya Gurung, because it seems like there's a network blackout.
Okay, so in terms of recommendations, we should not wait until later to address the development concerns of displaced persons. Then inclusion of refugees, stateless persons, so inclusion of refugees and stateless persons and other persons of concern is very important in terms of addressing the short-term, medium-term, and long-term recovery and rehabilitation plans. Priority must be done for health and also mental health. And then also not forgetting access to asylum, which should be fair and accessible. Livelihoods, it's important to address the economic recovery of livelihoods. Education, no one should be left behind because it will be very difficult to catch up. And also consideration must be made for survivors of sexual and gender-based violence. And then also engagement of local actors and refugee-led organizations, because it's a more sustainable way of addressing the negative impact of COVID-19. And then lastly, government support. It's important to provide support to governments during this pandemic, both at the local and the national level. Thank you, Bat.
All right, thank you so much. I think Miss Devi Maya Gurung, yeah, I think I interrupted you during your intervention. I think you can now finish your recommendations, please. If you are there and the network is okay, please, you can go ahead before we take Miss Maria.
It should be continued. But these programs should be sustainable and they should be longevity. It should be continued. And then the kind of support that we are talking about when it comes to psychosocial counseling. By the local government. And also like the national facilities provided by the national government.
र जति पनि चाहिँ अपङ्गता भएका
and all that is all kind of support that has
ओभर भएको हुन्छ दिनुपर्छ भन्ने म आग्रह गर्न चाहन्छु म प्रश्न पार्न चाहन्छु सक्यो
Yeah, all right. Thank you so much, and apologize for these network blackouts and technical faults. I think we can go ahead now with Miss Maria Fernanda Ceballos. Can you please share your recommendation?
Claro que sí, Bart. Muchas gracias.
Yes, of course, Bart. Thank you very much. First of all, we need to coordinate institutional work. All institutions in the state should be coordinated. And the next step is to coordinate with NGOs in order to ensure and improve our response capacity. We also need to coordinate with international organizations. I think the role of international cooperation is also very important. Now we really need to be more connected to the individual needs of countries, and there needs to be a better dialogue with the state. We mustn't forget about the communication that has to be ongoing with civil society organizations. And we need to consider those who need international protection. What we do directly affects people's lives, so we must always do our best for them. Thank you.
Yeah, muchas gracias. Yeah, I understand. Thank you so much. Thank you, everyone, for this very useful round of discussions. I think we have heard a number of really good examples of positive and protection-sensitive responses, and importantly, the many ways in which concerned individuals themselves have stepped up to engage as active participants and leaders in the responses. Thank you so much for that. I would like now to turn back to Ms. Triggs for some last words before we close this panel. I hope Ms. Triggs is still here with us. Ms. Triggs, over to you.
Well, thank you very much, Bart, and thank you all so much for your very thoughtful, considered reporting of your activities, but also your thoughtfulness in recommendations. It's been a real honor for me to listen to you and to really experience the credibility that you bring, the honesty that you bring in explaining what are the needs on the ground. And I think that we're all listening at UNHCR. What we want to do with the recommendations you've made is to take them into our work next year. And we greatly value what you've done. I know we're running out of time, so what I'd like to do is just run through briefly a few things that came out of your presentations, without taking up too much time. But firstly, I wanted to say, this is, of course, the High Commissioner's dialogue. It wasn't a meeting or a forum or anything like that. It was intended as a dialogue. And I think with the technology and Barth's wonderful moderation, we've actually achieved quite a lot. We've been able to listen to each other, and we've been able, in many places, there are crossovers of the ideas that underpin the work that you're doing. There's many similarities and themes across the work that you're doing. And I hope that your contributions will help to keep this concept of the dialogue at a global and technological way into the future. Perhaps firstly, if I may, I'd like to say a little about how much we really appreciate the extraordinary leadership that Ecuador is providing. And Maria has really set this out. In particular, of course, Maria has understood the importance of documentation. It really is critical that the documents become available, and the idea that visas or other documentation could be available on the phone is really a very exciting one. And I think we're all seeing the advantage of this. It can be used, as Maria says, whenever and wherever we need to use it. I was particularly impressed by Maria's discussion of her government's very, very careful efforts before COVID-19 to embark on processes that would allow speedy and fair processes of asylum. And that is absolutely fundamental to all of the protection roles that we have. So thank you very much to Ecuador. It's a true leadership position and we appreciate it. Maria also made a point, and I think it's a very fair one, that all the talk of technology, and we've all been talking about it, nonetheless, we have to be sensitive to the needs of other groups in the community for whom mobile phones and technological processes are just not familiar. And I think for that reason, it's been really interesting to listen to our colleague, Tamara. It's been wonderful to hear you, and such a pleasure to hear from you, to know that you've been through the trauma of displacement with your husband as an older person, and to see what you've done. And I think your key message is, don't ignore us, include us, and we can be so productive. We can do so much together. And I think you say that the history of your life is that together we can respond to challenges. And I think that optimism from you is absolutely enheartening to all of us at UNHCR. We really need to hear that. But of course, you make the point that I must say I'm very sympathetic with myself. And that is, sometimes it's nice to read a paper or read a piece of paper that's got everything on it, and then you can put it away and you go back and reread it. So I think the point that Maria understood, and clearly you did as well, Maria, is that in providing information, we need to be aware of the audience we're dealing with. Thank you very much for the perspective from the youth, from Ayla Al-Kassan. I think you really, of course, emphasize the importance of statelessness. And I'm very pleased that you've raised it as strongly as you have, because it tends to get lost a little. We talk about refugees, asylum seekers, people displaced, but some of those that are really in need of international protection are those who don't have documentation. And they can't, without that documentation, have access to the simplest of things, whether it's a bank account or a hospital or getting children into education. We need a recognition of people's identity, and thank you for that. But also, Ala, you brought in the vision of youth. The need for equality, whether it's in Parliament or whether it's through access to education, and you said many times that education is the way to the future for young people, and I think that is something young people fully understand. Without it, it's very hard for them to progress, and so I think that's an extremely important recommendation. And I think we all need to work harder on scholarships to move across countries to welcome environments, to give regular pathways to young people, to give them access to education. We know what they can achieve if they're just given those educational opportunities. And I think you've made those points loud and clear for us. Thank you very much to Davi for talking about those with disabilities. We do forget sometimes that among those vulnerable people, people with disabilities rank very high. Unfortunately, very many of the people that we deal with, refugees, asylum seekers, displaced people, and stateless, have a high percentage of disabilities of one kind or another. And I think the work that's being done in Nepal through your association is really remarkable, and we take our hats off to you, and have really appreciated the detail of the programs that you're running, and you've particularly stressed psychosocial support. And we will really make sure that that's on our agenda at UNHCR to support your work and as much as we can, and to encourage donations and support from other organizations to do it. The point that a number of you have made, and I think it's an important one, is the sustainability of programs. And this was made also by Devi in relation to disabilities, that when we set up a program, we need to build in an element of sustainability, that it just doesn't come and go over a year and disappears. We need to be able to be sure that we're providing it for a much longer period, so that it becomes something that can really have an impact in the community. I'm not sure if I've responded to all of the points. One or another point that has come up a great deal is gender-based violence. that is really has been one of the particularly shocking aspects of COVID-19. In our work here in Geneva, where we receive the evidence, so we hear about the call centers that we've set up all over the world, it was amazing how quickly, within 2 or 3 weeks of COVID and lockdowns taking place, we started to get the news back from our field officers that the call centers were being inundated with women and families calling for help because of domestic violence and gender-based violence and the exposure of children to all the consequences of social and economic breakdown and breakdowns of families in very vulnerable positions. And I think we clearly need to work on gender-based violence through information, through training, and through the provision of services, safe houses, and access to agencies that can assist. Of course, technology has underpinned a lot of what we've been talking about, and that, of course, is why we're able to do this today. So congratulations to all of our technological staff that's helped make this work. We've been able to include everybody, and we've heard the views of everybody, so thank you. And that really brings me to my last point, and that is, I think you all agree that critical for managing COVID, but also for managing future pandemics, future emergencies of any kind for vulnerable people, and particularly those displaced, is inclusion in society. We can no longer have different categories and statuses of people when we've got major emergencies. We must be sure that everyone is included in education, health services, access to livelihoods. No one can really ever get their lives back together again without access to employment and to education. So I think we agree with so many of the points that you've made, but I think we've also learned about the various ways in which we can respond so positively. And I've appreciated that today, that you've really emphasized all the good programs, all the best practices that you've been employing. And of course, Ecuador through Maria has shown that states can lead the way with this. But equally, Maria and others have made the point that to be successful working together, we need to work with civil society. We need to work with the private sector, with religious groups, with scholars, but also, of course, particularly to hear the voice of the refugee community and refugee-led organizations. So there's so much that I could talk about. It's been inspirational for me, and I'm sure for my colleagues. Thank you, Bart, for your great moderation. You've managed wonderfully well to keep a smile, as I know you always have, and to take us through just a few minor glitches, but we've basically managed the technology. So thank you all very much. It's been wonderful, and I hope we'll maintain our contacts with you and take up your ideas and recommendations next year as we develop our program with our member states and our many donors and supporters. So good evening or good day, wherever you are. Thank you, and I hope that I can meet you in person before too long. Thank you very much indeed.
All right, thank you so much for this last word. I hope you were really clear, you were short and straight to the point. Thank you for paraphrasing our discussion. So now with these last words, we are at the end of our time. A strong word of thanks to everyone, to the distinguished panelists, and to all of you who signed in for your valuable contributions. A recording of the events will be available on the app in the upcoming days. This event was the second one in our 4-part series of displacement in the context of pandemics. The recommendations made today and during the virtual events will inform the discussion on the outcome of the dialogue, and way forward is set for the 9th of December 2020. The next session on resilience and inclusion in health will be chaired by the Assistant High Commissioner for Operations, Mr. Raouf Mazou, on the 18th of November from 15 to 17 hours Central European Time. Thank you, everyone.